The world has been going through a very difficult time with COVID-19, and in my capacity as the Managing Director of Nyaho Medical Center, we have been playing our part to ensure that Ghana's response has always been strong, and whereby private and public sector have had to work together. We are so proud that we've been doing our very best to work with all the different agencies, being able to actually test for COVID. Everything that we do is really for patients, and we do our best. And in this time, we are reminded that even ourselves are patients, and all of us have families, all of us have parents, and I think that that has been our message to our staff, that everything that we're doing is really for all of us as individuals and for the community. I wanted to share my personal experience, and I hope you will listen to my heart, because for me to do this is really for me to live up to our Nyaho values of authenticity and transparency through building that culture of trust. And it's really important to me to ensure that I'm constantly living out everything that we stand for at Nyaho. A few days ago, I fell ill. As of yesterday, when I got my results, it was found that I was positive for COVID-19, as well as my family. I want to actually say that this news was a mixed feeling, because personally I was unwell. I was having a fever, my body was aching, but the good thing was that I didn't have any chest symptoms. And I have a number of risk factors. If you've seen my TED Talk, you'll know that I once had a heart condition in the UK that had to be treated as an emergency. And so for me, getting this result, my first question was, have we done everything that we can to really take care of my family? And I was so pleased to say that to the best of our ability that we had. And I'd like to commend our medical team in Nyaho. But I knew that it was important for me to just be transparent and authentic, because that's really how I've always lived my life. And I didn't want there to be any ambiguities or doubts, because for where everyone has been working so hard, I really wanted to make clear that this was as a result of community spread. From March 23rd, our organization had moved to new ways of working as part of our business continuity plan. We were privileged to be able to work remotely for non-clinical staff, and I was one of those who was working remotely. What I can say is that we actually are running most of our meetings virtually. That's our weekly executive meetings, our management meetings, even our board meetings happen. And so that for me was really a testament of the decisions that we made to protect our staff and also protect our patients. And especially when I found that I was unwell, I ensured that I did not go to any meetings. And that was really important, to ensure that whenever anyone is feeling sick, our advice is to stay home, isolate, and then get tested as soon as possible, so you can know your status. Especially in my house, myself as a doctor and my wife as an infectious diseases specialist nurse, I think that we have gone through this process with our children. It's been so reassuring to see my daughter, using the hand hygiene protocols in terms of how to wash her hands. And that for me has been such a blessing, to involve our children in this time. And so we've really tried our best to keep our families safe, and whereby we've restricted access. I think that's where, to the best of our ability, it was an opportunity for us to be fully engaged in this process. I know that there is a lot of stigmatization happening currently, and that is really sad. I wanted to make sure that by me opening up and addressing my result in real time, I wanted to do a few things. I wanted people to hear my heart, that I am a father like everyone else. I have concerns, but whereby we have evidence and whereby we have data, the majority of people that have COVID-19 will actually be fine and will be well. It's really important for us to put things in the context, and it's really important for us to know that in some circumstances like this, we have solutions. Even though they're not perfect, we still have a way forwards. I would also like to say that we do have clear guidelines. In my commendation to the Ministry of Health, the district, the national, the Ghana Health Service, even the private sector players who've been playing their parts. This is a time where we come together as a community to ensure that people's lives are protected and saved. And I'm so passionate because for myself and my family, I want the best for my family. I know that all of you care about your families, and it is important that in this time, we put our differences aside and we focus on creating a safe environment for our future. And so that's whereby the second step for me about stigmatization is that it is absolutely unacceptable for us to point hands or blame people. When we have a cold or the flu, we don't really point fingers and we don't really say that, oh, there's a problem for us having these. Rather, what we do is that we actually start to prevent the spread and we start to isolate ourselves. So I want to assure you, and I think that's where for me, I feel comfortable to share my status in the hopes that other people will feel comfortable to share about their own experiences and to normalize this, because this is a new normal. And I hope that by me being transparent, you'll respect the privacy of my family, especially as I go through this like everyone else. I have full faith that the right things will be done. And that's really whereby I think that I urge for patience, because where we will do our best as a country, definitely it's a continuous improvement time, and it is one that we need to keep the focus on the problem. The problem is the virus. The problem is not human beings. So with this, I don't really want to take too much time, but I just wanted to share my heart, because I know that I'm not going to be the only one. It's not going to be unique to me, and other people are going to be experiencing this at some stage of their lives, if you haven't already. So let us spread the word that there is no need for stigmatization. And definitely there is need for us to continue the hand hygiene, because whereby there's no way of anticipating who has it and who doesn't, we need to continue wearing the face masks, we need to continue washing our hands, we need to continue social distancing. And so I hope that by me sharing my story, this will help deepen the information. On our Nyaho website, we do have information where we try to share and will continue to share. And I want to assure all our stakeholders that I will continue to rest and take care of myself and my family. Our board is extremely supportive, and I have a strong team. And I know that the business will continue, because everything that we're doing is really about the patient and their families. I have hope. I believe that things will get better, and I hope you will too. So I pray that you have a great day. Thank you for listening to me, and I hope you keep safe. Thank you very much.